Welcome, students. We are starting the last section of your Chapter 8 Pharmacology and Pharmacy PowerPoint. So today we're going to be going over slides 81 all the way to the end, which is slide 101. We're going to be covering quite a few different topics today, including antibiotics, antiparasitics, antifungals. We'll talk about disinfectants, sterilization techniques, and so forward. All right. So our first topic that we're getting into is antibiotics, also known as antimicrobials. So these medications, they will kill or inhibit the growth of microorganisms. Be aware that there are several different types of antibiotics, and it's not one size fits all. But I want to remind you that it's not your job to know what antibiotic we would use for what condition, right? That's a doctor who would need to know that because they're the ones prescribing those medications. But you should know what the medication is. So if I asked you what is cephalexin, you should be able to tell me that that's an antibiotic. Um, it's important to know about the different classes, but I more or less would rather see an assistant just be able to tell me what that drug in basic forms, what it is, what it does, and how we're going to be administering it. Now, if you decide to continue your education and become a technician or a doctor, you will absolutely learn more into the details and reasons of why, again, we would script out one antibiotic for this condition versus another. You would really get into more of the scientific base for that. Again, as an assistant, it's really just wanting you to know the basic medications, the names, the uses, and how we give them. So, with that being said, keep that in mind as we're going through these. So, let's talk about the different types of antibiotics. There are bactericidal. Those are antibiotics that kill bacteria. There's bacteriostatic, and usually bactericidal and bacteriostatic, they go hand in hand. Like a lot of antibiotics do both. And bacteriostatic means that it inhibits bacterial replication. So it won't kill the bacteria, but it makes it to where they can't reproduce and it can't get worse. Then we have virucidal, which will kill viruses. There's also virostatic that helps inhibit the replication as well. There's protostatic, which is inhibiting protozoal replication, which that's going to be important later when we start to talk about parasites. So if we have a parasitic infection, specifically with internal parasites, we will want to use usually an antibiotic as well as an antiparasitic to treat any infection, because usually they will get some type of an infection from that. We can also use fungicidals if it's a fungal infection. This will help kill any fungi that's present. And antibiotics work through different mechanisms. So certain antibiotics will have different effects on the body and the cells and how it attacks these bacteria, viruses, fungi, protozoals. They can have effects on the cell wall, cell membranes, ribosomes, enzymes, metabolites. Again, what you need to know is, and I would pay attention to kind of these different terms here. Again, bacteria versus virus versus fungi versus protozoal, because those are all different types of infections. So we're going to start to go through some list of antibiotics. We're going to talk a little bit about antibiotics and then go through common antibiotics. A lot of those you saw on the topic list for the term project. Now, before we look at the different types of antibiotics and their classes, I want to touch on this point here about antibiotic resistance. So, antibiotic resistance can happen to any animal, to any person, and it's usually due to overuse of antibiotics or stopping the use of antibiotics before the treatment is completed. Resistance means that some of those microorganisms can survive in the presence of antimicrobials or antibiotics, which is counterproductive. We want the antibiotics to kill and eradicate those microorganisms. Resistant antibiotic or resistant any cells or bacteria, viruses that are antibiotic resistant, that means that you can give the antibiotic and those cells don't care. They're still going to be there. They're not going to be disturbed. And again, if we're using antibiotics a lot, over and over and over, chronic use of antibiotics, these cells get used to those antibiotics and they'll start to recognize those. And then, like, let's say it's reoccurring ear infections, for example. Certain breeds, especially dog breeds that have those floppy ears, like spaniels, they can get really moist and floppy in those ears, especially if you live in like wet, hot environments like Hawaii. Um, they can get ear infections just over and over and over again. Of course, we want to treat the infection. But if we keep doing antibiotics, especially multiple times a year, it's going to get to a point where it's not going to work anymore. And now we have to find more aggressive antibiotics to get the job done. We have to find antibiotics that the cells aren't familiar with because, again, they're becoming resistant to others. Resistance can also happen if you give antibiotics and you stop before the treatment is over. It's super important that if an animal is put on antibiotics, that you finish the entire treatment. I've seen it where owners, they're like, oh, well, the pet started to feel better. And they will, right? A antibiotic is going to help kill that bacteria. It's going to eradicate it out of the body. They should be feeling better. That being said, that doesn't mean you stop giving the antibiotics because when you give the antibiotics and then stop giving it, and it's not complete, it didn't completely eradicate the infection's just going to come back worse now. And now those antibiotics can't be used because they're going to be familiar to them and they'll be resistant. So, ways to avoid resistance is to not treat often with antibiotics, try to keep that at a minimal, and make sure that the owners give the entire full dose of that antibiotic. You know, if it says to give it for a week, make sure they give every single last dose to avoid resistance. Another topic that we're going to look at here with antibiotics is residue. Now, this is a controversial topic, and I'm talking about antibiotic residue in livestock animals. So, livestock animals, I'm talking about cows, goats, sheep, swine, poultry birds like chicken, ducks, turkeys, any animal that's going to be used for their meat or eggs or dairy products, right? They're food animals. If we give antibiotics to animals that are production animals, there can be antibiotic residue. This is an accumulation of the drug or metabolite in tissues or food products. So there are rules, there's regulations that these farms and agricultural companies have to follow. There are withdrawal times. So let's say a cow did get a infection, a dairy cow, for example, got a mammary gland infection. Can happen. We give the antibiotics. There's going to be a washout time. Depending on the antibiotic, depending on how long we had to give the antibiotic, that will vary that washout time or withdrawal time. So it could be 2 weeks, it could be 2 months. It just depends. And during that washout time, we are not allowed to sell the product of that animal because it's pumped filled with antibiotic residue. And if you consume that, there is possibility of becoming resistant to antibiotics you didn't know you were exposed to. So that's why there's really strict food rules regarding this in the United States. So be aware you aren't going to be at risk for consuming antibiotics in dairy or in meat. There is withdrawal periods for a reason, and they test the meat before it's allowed to be sold. They test the dairy before it's allowed to be marketed. So there is very strict protocols in the United States, and it makes me a little upset when I see certain labels on foods that I feel like are just really misleading. You'll see dairy products and stuff, and they'll say things like comes from cows that aren't treated with antibiotics. And any company could put that on their label because you're not selling products with antibiotics in them. They're going to have a withdrawal or a washout period. So it doesn't mean that the animal never had antibiotics. It just means that it doesn't currently have antibiotics, which of course it doesn't because that's illegal. You can't sell the product. So there's certain marketing gimmicks that you'll notice that are, again, they're really misleading, and it's usually they're trying to get higher dollar for their product, but it's just the same thing. It's just smart marketing. So We don't talk too much about livestock in this program, but I do encourage you to do some research with that. I try to incorporate it when I can because I am kind of the only one here on the VA team that has large animal experience. So I try to incorporate it the best that I can. But I do recommend doing some research. Don't trust everything you see. Don't trust every label that you see either. Question everything. And know that there are a lot of marketing gimmicks out there to get you to buy certain products, when in reality they all, have to follow certain um, rules and regulations. Now, there's also rules and regulations on dairy products for like pasteurization, things like that. So there is inherent risk of consuming raw dairy products. As you may know, there's risk of getting several different types of infection. For one of the most common ones is Listeria, and these can be fatal. They can be very serious, and that's why we pasteurize milk in the United States. Now, raw milk is a thing. You can buy and consume raw dairy products and raw milk, but remember that's at your own risk. They don't test raw milk that's on the shelves. They batch test it, and there's always a possibility that the batch that you're getting wasn't tested because they randomly test them. Um, I can't, I wouldn't be sitting here telling you to consume one product over the other, but just be aware that there's reasons for that pasteurization, and it's to kill off any bacteria, or microorganisms that are present to make it a safe product to consume. All right. With that being said, we're going to start to look at different antibiotics and know that there are many antibiotics that are blanketed under these specific types. So, for example, penicillins, it's the "-cillin" suffix. There's a lot of different "-cillins", a lot of different "-cillins". Penicillin's one of the main ones that's going to pop up that you'll see. We use penicillin a lot, especially in livestock. These are bactericidal, and these are broad spectrum. So any of the "-cillins" from that family, they're broad spectrum, which means that they work on gram-positive and gram-negative bacteria. Now, you don't really need to know the much about the diagnostic side of it, but just know that it's broad spectrum, meaning that it treats and can be used for so many different types of infections against bacteria. And we use it again. Penicillin is going to be the number one antibiotic that you would see in livestock medicine, and it's injectable, and that's why it's really easy to give for herd size, and very easy to give large amounts in like a herd environment. We also have cephalosporins. So these are the ceph drugs. For example, cephalexin. These are also bactericidal. They are first generation effective against gram positive, second and third generation against gram negative bacteria. Again, what you need to know about this is that it's another broad spectrum. You are going to see that often. So cephalexin or any of the ceph drugs, we see that a lot. We use and treat small animals with, it's a capsule form of cephalexin. We also use bacterians. And they come in topical creams or ointments. They're broad spectrum. So if there was a wound or a laceration and you wanted to treat directly on that wound, usually it's in combination with oral antibiotics. But if this was an animal that ran away and they just came back and they were, had some injuries and they might have been old, we might want to treat with two different types of antibiotics, one orally and one topically to help, especially again, if these are older wounds, um, and or if they're just really severely infected. We can definitely use from both sides. There's aminoglycosides. These are also bactericidal. They are known as like the mycin suffix. We also have fluoroquinoles, which are bactericidal. And they're broad spectrum, same thing. A lot of these are really broad spectrum. So used for so many different things. A lot of this has to do with therapeutic dose, and I want you to keep that in mind. Therapeutic dose is that sweet spot of dosing that is going to have effect, but it's not going to overdose them. So certain antibiotics, we can give at higher concentrations, which can be better if it's for a more severe infection versus others that, again, can be a little bit tapered down. You don't need to know that. That's the doctor that's going to decide that. But again, we have a lot to choose from. We also have tetracyclines. These are also another bacteriostatic antibiotic. The cycline suffix, so for example, doxycycline, you're going to use that all the time in animals that get kennel cough, dogs that get Bordetella or kennel cough. Even if you vaccinate for it, there's many strains of kennel cough. It's like the flu, where there's many strains of it, and you can still get sick with it even if you've been vaccinated for it. Now, we also have sulfonamides, which are sulfa drugs. These are also bacteriostatic and they can be bactericidal as well when combined with other compounds. So when it's potentated. Um, that being said, sulfa drugs, we use them a lot. A big reason is because of protozoal infections. So we use sulfa drugs for parasite infections all the time. If a patient has internal or external parasites, we're probably going to go with the sulfa antibiotic. That being said, because we script it out a lot, resistance is also common. So we do have to be really careful with, again, how often it's being scripted out. Ideally, with things like protozoal infections, intestinal parasites, we would ideally place the patient on a preventative medication. So this is a monthly preventative, like a flea and tick medication, but they make it for intestinal parasites, and it will prevent them from getting any type of parasitic infection. So ideally we could do that, but if that's not an option, and we just have to continue treating, then we just have to be aware of either rotating antibiotics or just again of not overusing because this is a drug that can absolutely we see the resistance with because it's just really common. We don't really want to see animals on antibiotics more than once a year. I mean, ideally, it would be even less than that, right? Once a year can still be a lot. So, but you will see certain patients that have chronic health conditions that require to be on certain medications often. And sometimes that means that they are immunocompromised and they get infections really easily. Chronic skin patients might be on antibiotics all the time. Same with steroids, stuff like that. Lincosamides are another type of antibiotic. They are bacteriostatic, also bactericidal, again, depending on that concentration. So where are we at in that therapeutic dose? We also have macrolides that are bacteriostatic, metronidazole, that's bactericidal. Metronidazole is a medication that you will also see a lot. We use this just like with the sulfa medications with protozoal intestinal infections. So if they have a parasite infection, or in all honesty, any type of gastrointestinal upset, metronidazole is really the antibiotic that is going to be most commonly chosen for any type of gastrointestinal distress or infection. It's just very effective for those areas, and a little bit more gentle on the stomach than other antibiotics. So when you have a patient that already has some stuff going on with the stomach and the intestines, you don't want to make it any worse than it already is. So metronidazole is a really safe antibiotic with very little stomach upset. Certain antibiotics can absolutely cause diarrhea or constipation. So, wanting to make sure that we choose one again for that condition. So, as stated before, you may not know details like that. Over the years, I've been able to accumulate those kind of knowledge and details, but in reality, it's going to be the doctor that's going to know that they would choose metronidazole over a penicillin because it's going to be more gentle on the stomach and treat that condition better. So, not for you to decide, but knowing that metronidazole is an antibiotic and that we commonly use it in GI tract cases, that would be the perfect amount that I would want you to know. Okay, we're just continuing on. I know there is a lot, a lot, a lot. So there's nitrofurans. These are bacteriostatic or bactericidal. Chloramphenicol. You may have heard me talk about chloramphenicol. I really it's chloramphenicol is one of those drugs where it's a little scary, but my goodness, have I seen the magic that chloramphenicol works on patients that are that have antibiotic resistance. So they have bacteria that doesn't respond to certain antibiotics. Chloramphenicol is that medication that will come on in and wipe out that infection. It is a super strong antibiotic. It's bacteriostatic and bactericidal. However, it is toxic to humans, and we have to be careful when we're scripting this out. So when if you are filling this prescription, it comes in these massive yellow tablets. I mean, they're huge. And you have to wear gloves. You have to wear gloves. I would even go as far as wearing a mask because you don't want to like breathe in any of the pill dust, and you certainly don't want it making contact with your skin. The reason why is it causes aplastic anemia to develop in humans. So it can affect your red blood cell count, and it's banned in all food animals. So we can only use chloramphenicol in dogs, cats, and horses. Um, can't really use it in any of our production or livestock. And it's because of that aplastic anemia. But again, if I've got a dog or, an animal that's resistant, we can't figure out a good antibiotic that's working. This is going to be the one that I've seen veterinarians fall back on time and time again, and it always works. I have never seen chloramphenicol not get the job done. But it is a little scary. You got to be careful when you're handling it. And that's something to remember that not all drugs that we use in animals are safe when in people. And yes, your skin is the largest organ in the body, and it is a massive absorbent. Think of your skin like a massive sponge. Anything you touch or have contact with can absorb into your skin. So even just filling a medication with your bare hands and touching the pills, you absolutely can have it get absorbed through your skin and feel side effects of that. So there are certain medications, chloramphenicol is one of them, that you have to wear gloves with. That's non-negotiable. Now, there are a lot of variations of drugs. So they did come out with another version of chloramphenicol. It's called fluorphenicol. So it's like the same class, really strong antibiotic, similar, but no aplastic anemia develops. So we could use fluorphenicol in cattle or in livestock and it would be okay. Um, And it, again, similar mechanisms can use it. It is more expensive. And chloramphenicol is already pricey as an antibiotic because, again, it's going to wipe anything out. So chloramphenicol is even more pricey. But if that's what we have to do to clear the infection, that's what we have available. The next one here is rifampin. This is another bacteriostatic or bactericidal antibiotic, and it is used with antifungal agents. So if the patient has a fungal infection, this is typically talking about an external parasite. So I could be talking about mange, I could be talking about ringworm, rain rot in horses, any type of overproduction of candida, yeast, any fungal infection that can happen. So rifampin can be used in conjunction with an antifungal medication to help clear any infection that's been caused. I've seen patients that uh, really severe cases of mange. And you may see this if you ever work in rescue type environments. In severe cases of mange, it's essentially little mites that are on the skin eating away at it, and the skin will start breaking and getting really weak. And when it does that, infections can start really easily. So, usually in cases like that, you are treating not only the fungus and the fungal infection, but you're also treating an infection itself. And that could turn into a bacterial infection in the skin and be keep becoming worse. So we could use something like rifampin that's great for fungal infections in conjunction with another antifungal, especially with severe cases. With that being said, let's take a look at some antifungals. There's amphotericin, and that is an IV treatment for deep or systemic mycotic infections. So when you think of systemic, so think of like systemic circulation, right? So it's going to be deeper into the skin and into the tissues versus something that's superficial. So like nystatin, the next medication, this is a treatment for superficial mycotic infections. Superficial is like basically on top of the skin or just right below. It should be able to be seen by the naked eye. And so this is really effective against like candida. So a big contributor to fungal infections is candida. And if you didn't know, candida is just a fancy word for yeast. And every single person and being has yeast naturally living on their skin. It's natural. It's not nothing wrong with that. The problem is when it gets out of hand and the yeast start to replicate and just have a party, and now there's too much yeast, and now we have a fungal infection. Overproduction of yeast. And usually that happens when the environment has a too high of a pH concentration. That's like the perfect breeding ground for candida. When it's acidic, the candida can't survive. Um, that being said, it's very easy to see fungal infections being caused by candida. For example, I brought it up a little bit, rain rot. We see this in horses a lot. If you live in an area where it rains and it's cold, um, for example, I'm from Washington State and I have horses up there. My mom has a ranch. And so in the winter, we will put blankets on the horses to help keep them warm, especially the older ones that might not have a whole lot of muscle mass left. So we to help keep them warm in those cold winter months. But in Washington, it rains a lot. It snows a lot too. And when it gets wet and they're wearing a blanket, if that blanket is not waterproof, and the water seeps into the blanket and now it's making contact with the hair and the skin, it can't dry itself out, right? Unless you were to change the blanket, and dry it out. It takes days to dry out. So if you just leave a wet soaking blanket on a horse, one, they could get hypothermia, but two, they're going to get rain rot. And that's when the yeast, again, it just has a party. With that hot, wet environment, it's a perfect breeding ground for yeast. And so the rain rot, it is super itchy for horses and their hair just falls right off. But the treatment for that, we can give medications, but a lot of the time for antifungals, a lot of it is topical. We give a lot of different topical medications, so directly onto that skin and where that fungal infection is present. If it's severe, though, we're probably going to give a oral medication in conjunction with a some kind of topical. All right, it should be good. Sorry, there was a little lapse there in my internet connection. Please let me know if it does continue. It just showed me a little bit that it was the connection got a little unstable there. So if it persists, please let me know and I can always readjust. The next one on this list is flucytosine. This is used with AMP B. So it's similar, can use it together, and it's effective against Cryptococcus and Candida, so two main culprits to any type of fungal infection. Now, some that you may have heard of, fluconazole, one of the most common antifungals that they use in humans. They also use it in animals. We also use ketoconazole or itraconazole. These have fewer side effects than AMP-B, and they're super effective. For example, they humans can absolutely get. I live in Hawaii. You guys know, or you may not know, but I do. I live in Hawaii. And when people go to the beach, right? People go to the beach, it's beautiful, it's sunny here, they go to the beach and they get obviously they go in the water, they get wet. For somebody like me, I have really long hair. So the hair goes all the way down my back, right? So if I have that wet hair going down my back and then I lay down on my towel, which is now going to be wet, think about how hot that hot, warm environment, and it's perfect for yeast to replicate. And so it's common in Hawaii. I'll see different tourists that start to lose patches of their tan, and it looks like sunburn. It looks like, skin kind of that's kind of getting patchy because of a burn, but it's not a burn, it's actually yeast. It's actually a overproduction of candida on the skin. And it's super common here. So if you are ever going to come to Hawaii, you're a tourist coming here to visit, keep that in mind, put your hair up in a bun, make sure that you're not just having like that super compressed area with that heat on your back. It's so common. But again, it's a really easy treatment. And the reason that I bring this up is because fluconazole, that's the medication that they more than likely that they would give you for it. Um, and it's a medication that you would take once a week for 2 or 3 weeks until it clears up. They also have topicals, of course, too. But yeah, we see it in humans. We see it in animals. And again, that yeast, it's natural. It's supposed to be on the body. But when in that perfect environment, hot, humid, high pH. It has an absolute replication party, and then it becomes out of control and into a fungal infection. And that can spread throughout the entire body. If you've ever heard of a yeast infection, same thing. That's just fungus. That's literally just that's just candida. It's just yeast having a good old time. And when we think of yeast infection, you might think of like a vaginal yeast infection, but it can be anywhere on the skin, anywhere on the body. And in animals, think of like their armpits, their hip area, any area where it can, their ears, where the moisture and heat can just get trapped inside. Perfect places for that to happen. So that would considered to be a fungus, we would treat with antifungal. Griseofluven is another antifungal. It's fungistatic, so it also stops that replication. It's effective against a lot of different dermatophytes, especially dermatophytes that cause ringworm. If you don't know what ringworm is a very common fungal infection that's on the skin. It is zoonotic, which means it can transfer from animal to human and human to animal. In fact, fungals, a lot of parasites are considered zoonotic, where again, we can pass it from human to animal or vice versa. So please be aware of that when you're working with animals. Um, if kind of rule of thumb, if I have a patient that's coming in and they have a skin condition and we don't know what that is, I'm wearing gloves because I don't know if it's something that I can get. Same thing for if this patient has an upset stomach, like they've had diarrhea or they're scooting. I'm wearing gloves because they might have parasites, and you can get parasites. You can absolutely get, for example, ringworm can it spreads like wildfire. If you make contact with your bare skin on ringworm, you absolutely can spread it to yourself. It's that simple. Ringworm is, you think of worm and you think of internal parasite, but it's actually an external fungus. And again, it's caused by dermatophytes, which is actually small little mites that can go onto the skin. And it shows up, they almost look like hot spots. The hair will fall off in those areas, and you'll see like these round red or pink rings all over the skin. And they're itchy, they can be irritated. Also, they might not lose their hair. So it's important to know that, again, what I do, because ringworm is so prevalent, is if I see that a kitten, especially if it's a kitten that's coming in, if it's a first time visit, if they're a rescue, like they found them off the side of the road, they haven't had any medical intervention, we want to make sure to do a Woods lamp test first before you're touching and getting all sweet with that kitten. Because trust me, we love to cuddle and love on our patients. But if I don't know if they have something, I'm gonna be pretty cautious until I can rule that out. I've seen people that, for example, I had a coworker who she was cuddling up this cute little gray kitten that came into the clinic. Cutest little thing. It was a rescue. And she comes back and she's like, look at this little baby. And she's kissing on it. We didn't know that it had ringworm at the time. It didn't have any outwardly signs of something of fungal infection on the skin. It could have been kind of a newer infection. And when we did the Wundt lamp test, that's when we take an ultraviolet light and we shine it over the patient. And if they fluoresce, um, like if you think of like cosmic bowling, when you wear white and it fluoresces under the lights, that's what happens when they're positive for ringworm. So if we do that Woods lamp test and they test positive, again, that means that they're positive for ringworm. And my coworker that snuggled that cat, she ended up getting a massive lesion on the side of her face, massive. And she had to go on medications. It took months for it to go away. So I'm telling you this so that you can be proactive with yourselves. Um, I know we love and cuddle and be able to get close with these animals that are our patients, but please caution yourself. Again, if it's some kind of any type of upset GI, any kind of skin issue, a feral or a rescue kitten or cat, be very, very cautious. Because you can absolutely get exposed to a fungus or to a parasite, and we can get those. No problem. We can absolutely contract those. So we want to make sure to have just that extra layer of caution. Okay, before we get into antiparasitics, we are going to take a quick break. And when we come back in from the break, we'll keep on going with the lecture again. We're about halfway through with our slides here, so about 10 more. So just give me one moment here. I am going to pause the recording. We'll resume it when we are back in from our break. All right, students, welcome back in from the break. We're just going to continue on here with our slides. Again, we're kind of at the halfway point here, about 10 more slides left to the PowerPoint for Chapter 8. So our next topic that we're looking at here is antiparasitics. We're going to go through some classifications of these medications. Again, anti being against, without, parasitics. So we are getting rid of parasites in the body. We're going to talk about internal parasites, a little bit about external as well. So there is, again, different classifications here. We have anthelmintic, which is killing various types of internal parasites. There's a vermicide, which kills worms, vermifuge, which paralyzes worms. There is antinematodal, which treats infections with nematodes, which is roundworts. There is anticestodal, which treats infections with tapeworms. There's antitrepidodal, which treats infections with flukes, and antiprotozoal, which treats infections with protozoa. So, depending on what parasite they have, will absolutely determine the type of dewormer that we use. This is why we have to do fecal testing before we treat for parasites. It's rare that you'll actually see them pass a parasite in their stool. You can see tapeworms because they look like little grains of rice, but pretty much any other parasite, it's very hard to tell. Most of the time, it's on a microscopic level, or they break up by the time they're in the feces, so you can't really tell or really notice. Um, so we do fecal exams. That's basically a fecal flotation test. So that's taking a poop sample and we put it through a sugar flotation test to then float the parasites and put them on a slide, look at them under the scope, and try to determine what they have. Um, so once we know the parasite that they have, then we can effectively treat with the antiparasitic or deworming medication for that specific parasite. But keep in mind, we don't usually see them. Again, the only one that's usually visible is tapeworms, and that's actually the one that you should worry about the least. And it's very common, and tapeworms are very easy to treat. Other ones are not the same way. We're going to look at internal parasitics first, and then we're going to look at external antiparasitics. Again, internal, I'm talking about worms or parasites that are inside their body. Internal parasites. So these are some antiparasitics that we can use if they have an internal parasite. So there's piperazine, which is a vermicide, and vermifuge, once a month dewormer. Some people choose to deworm their pets, like on a preventative monthly medication. With horses and livestock, it is standard to worm them at the change of every season. So typically, horses, cattle, any type of livestock animal is going to get a dewormer 4 times a year. And they're going to get a different dewormer depending on the season because there can be different worms present in different seasons. And that's standard always. We don't typically test livestock for parasites because we assume that they already have them. Any animal that's outside having contact with the grass, with the soil is the number one place of harboring one, bacteria, but two, parasites, especially stagnant water, things like that. So we have to be aware that any animal that's having contact with the grass and soil, which is typically in small animal medicine, we're looking at dogs. You may have a cat that goes indoor, outdoor, and so any cat that does go outside is also at risk. If it's an indoor only cat, the odds of them getting parasites is incredibly low. If anything, it's zero because the risk would, unless they're outside and having physical contact, the only other way that they can get it is from another animal. Um, so when it comes to dogs, I recommend doing parasite testing at least once a year at the annual physical exam. Um, and don't hesitate to put them on like a once a month dewormer, especially if you live in a place where it's prevalent. Or if your animal has gotten it once, it's the odds of getting it again is it's very strong because if you're walking them and having them in the same area that they got a parasite in the first place, it's very common that they can get reinfected even after you've treated them. So, things to keep in mind, food for thought. Again, doing annual parasitic testing is something that is recommended for all animals that are outside. To keep on going through our list, we have organophosphates. These are for internal and external parasites. Pyrantel is one of the most common antiparasitics that you'll be using. We use it a lot in horses, but we also use it in dogs and cats. It comes in a liquid or a paste formulation for horses, more of a liquid for our dogs and cats. With horses, they actually will sell it in a already pre-filled syringe, and then you will just dose it based off of the horse's weight or the livestock's weight. And we don't typically use scales in livestock medicine unless the hospital has a scale. But usually it's a farm vet driving to your farm. It's a little bit of a different dynamic there. So we use what's called a weight tape, and it's basically a measuring tape that we put around the chest or the barrel region of that animal, and based off of that measurement, it will give us an approximate of how much they weigh. It doesn't have to be an exact number, but around that approximate, around that 100-pound approximate. There's also carboxylate, and that's a IV adult heartworm treatment. That's old. We don't really use it anymore. The heartworm treatment that we use nowadays is called emecticide, and that is an intramuscular injection. So that's an injection that goes in the muscle, and that's an adult heartworm treatment. So if your patient gets heartworm, we can use that to help treat it. Now, we want to avoid that though at all costs. We don't want a dog or a cat to get heartworm. It's more common for dogs to get heartworm. I've actually never seen a heartworm case in a cat. Not that it can't happen. I've just never seen it in my many years of working in cat specialty. Um, what we do for dogs is we like to put them on a monthly preventative for heartworm. So your dog may be on quite a few preventatives and your cat as well, especially if they go outside. So there's going to be like flea and tick preventatives that you give once a month. There could be a heartworm preventative, and there could even be a once a month dewormer. So that's up to three that they could get every single month to prevent any of these things from happening. The thing about heartworm is that we can give them, it's called Interceptor or there's Sentinel. These are two different types of preventatives so that you would give them one dose every single month and it's going to prevent them from contracting heartworm. Heartworm are worms that quite literally live in the heart. Um, and as you can imagine, that can be extremely dangerous. It will end up killing the patient at some point because it'll strangle out their arteries and their vessels. Um, that being said, it's a really expensive treatment too. In order to do the treatment, the antibiotic or the injections and everything, it's thousands of dollars. Thousands. And there's no guarantee that you will actually ever clear the parasitic infection because heartworms are so aggressive. And the longer they've had them, the harder it is to eradicate them. So we try to put the patients on preventatives so that that's never a reality. Because again, a $15,000 treatment for heartworm is not ideal for anybody. And again, there's no guarantee that it'll actually work and eradicate all of it. So we do like to put them on a monthly medication. HeartGuard is another one that's really common for heartworm preventative. We also have DEC, that's another heartworm preventative. And then the last one on this list is antiprotozoals. These are mostly those sulfonamide antimicrobial medications. With Parasites, though, we do have external parasites. External parasites are going to be fleas, ticks, mange, any of lice, mites. We could even kind of group some of those fungals into that category too. But looking at external parasitics, again, some of those that I've listed, we usually will give some type of topical treatment. So, if it's fleas or ticks, medicated baths are great, even with, again, mange, anything like that. We can give oral medications to help as well if it's like a really severe but for the most part, this is going to be topical. So we can use certain chlorinated or hydrocarbons, different hydrocarbons, certain types of dog shampoos, any type of medicated shampoo, really. And there's veterinary grade medicated shampoos that we use in field, that are using like really high quality surgical scrubs and antimicrobials. We can also use organophosphates or carbamates. These are effective against insects, but they're safe for the environment. Pyrethrins or pyrethroids are going to be very common. You're going to see this a lot with, for example, horses. We use what's called fly spray in horses, and it is basically just pyrethrin, and it is in a diluted version in a spray bottle, and we spray that all over the horse. And it gives this knockdown effect where when the flies or mosquitoes they have contact with it, they inhale it and it basically knocks them out. Um, they won't want to have contact with that animal. So that can be really great to, again, it's an insecticide. It's very safe to use on animals and to use on areas, but it will prevent the insects I hate to say like annoying the animal, but it's very true, especially with like livestock and horses. They're outside pretty much 24/7 and exposed to all of those insects. And as you can imagine, it could be pretty irritating for them if they're just getting landed on all the time. Um, with no kind of coverage or relief. We can use fly sheets too for horses instead of sprays if they, are allergic to like permethrin or have reactions. We can use fly sheets or fly blankets, fly masks. It's basically just like a mesh material that can go over them to help protect them from external parasites or even things that are just not necessarily a parasite, but flies can be very nuanced. Mosquitoes too. Another antiparasitic is imitraz, and that is effective against demodetic mange in dogs. And remember, these are actually tiny mites that cause that mange. And we will go over this in a lot more detail in Module 106. So if you've taken Module 106 with me, there's an entire PowerPoint that's dedicated to parasites and treatments and diagnostic tests that we run. So you will learn more about, especially about demodetic mange. In that specific module. That's diagnostic imaging and testing. Now, Advantage, you may have heard of Advantage or like Frontline. Those are over-the-counter medications for external parasites. So they're for fleas and ticks. And you don't need a prescription to buy them versus like Revolution, which is like the veterinary grade version, you do need a prescription for. So Advantage is great against fleas. In dogs and cats, but it's not as strong as the prescription strength. And a lot of animals, the parasites are starting to become resistant to it. That's why they're having to do these new formulations of Advantage and Frontline. It's because the parasites are getting accustomed to it. It's not working as well. Honestly, I know that it's cheaper, but it's because the product's cheaper too. I do recommend to only use the products from your veterinarian. I know that they're more expensive, but they work. There's a reason why they're prescription grade. And you also know that you're giving a safe product to your animal. There are certain um, flea and tick medications that are on the market right now that absolutely are toxic to dogs and cats. There's especially some of the ones that are a little bit of the cheaper end, a little less expensive. Please refrain from buying those. Please. I think it's called I can't remember what it is. It's a green, I know it's in green packaging. And there have been so many cases of animals dropping dead, stroking out because of reactions with that antiparasitic. So again, if you are trying to give them a monthly flea and tick preventative, I highly recommend just using like Revolution or using NexGard or oh, there's another one that's on the market that's good for a little bit longer. But again, any of those prescription grade preventatives are that's going to be the best quality and the safest medication to use for preventative, which I think that any dog that goes outside, any cat that goes outside should be on it. Definitely. Okay, we're going to continue on looking at some more antiparasitics. Um, we have Daris powder. This is a natural insecticide. Dilamin, which is another natural insecticide. We can use sulfur. That can be effective against sarcoptic mange. And again, we'll talk about the different types of mange in a different class. Um, we're specifically just looking at medications here that can help treat. We can also give insect growth regulators. These prevent immature stages of insect from maturing into their adult stages. It's not toxic, but it will affect, again, the population of those parasites and stopping the overpopulation of them. It can be like an environmental treatment as well. There's also repellents, which go back into that kind of category with like the fly sprays with horses. So it's gonna keep insects off of animals. It's gonna repel them so they don't even make contact with that animal. Okay, now we're going to get into another subject of drugs. We're going to look at anti-inflammatory drugs. We're going to look at steroidal and non-steroidal anti-inflammatory drugs. So, anti-inflammatory drugs are drugs that relieve pain and discomfort by reducing inflammation. Inflammation is swelling in the body, and it's usually caused by infection. It can be caused by traumatic injury. It can be caused by illness, fever, many things that can cause inflammation. So these medications will help relieve that and relieve the pain that's associated with that. So there is steroidal anti-inflammatory drugs, which are anti-inflammatories that include a steroidal. And then there's non-steroidal. So it's another anti-inflammatory but doesn't have that steroid. Now, steroids can be really beneficial. For example, glucocorticoid drugs. We commonly give, such as like hydrocortisone, we can give prednisone, prednisolone, dexamethasone, a lot of different steroids under that category. Now, steroids can be really helpful. They can help promote healing, they can help decrease that healing time. Um, they can also help with patients that have recurring infections, especially things like skin infections, vaccine reactions, or a different type of reaction to medications. Steroids can absolutely be a lifesaver. And again, with a patient that's going through pain and discomfort, it's also going to help alleviate those that pain and discomfort from that anti-inflammatory effects. So there's different types. For example, hydrocortisone, that's a short-acting steroid. There's prednisone or prednisolone, which is intermediate acting. Prednisone is what we use in dogs. Prednisolone is what we use in cats. Prednisolone is just a broken down version of prednisone, but cats cannot metabolize prednisone. So if you give them prednisone, it literally will do nothing. We have to give cats prednisolone in order for it to have the effect. Now, you can give prednisolone to dogs. Again, you can't give prednisone to cats. It's not like it'll poison them or anything like that. It just won't be effective. It won't do anything. We also have long-acting steroids, like dexamethasone, that lasts for over 2 days, so over 48 hours. And these can be available in solutions, suspensions, injectable versions. But if we overuse steroids, we can run into problems. It can cause Cushing's disease, which is hypoadrenocortisone. So, or sorry, hyperadrenocortisone. So that's when the just overload of steroids, overload of stress hormones in the body, and it causes the adrenals to just go on absolute overdrive to the point where they can start failing. So we do have to be aware of that if we are using steroids, especially routinely in a patient. We do want to try to keep that to a minimum. But if the pet has to be on steroids to make them comfortable, we have to make sure the owners know of those inherent risks and know that Cushing's is absolutely a real problem that can happen when they're overexposed. That would be like an iatrogenic, which means that it's caused by treatment or caused by the hospital. Some more anti-inflammatory drugs. These are non-steroidal, so they have fewer side effects because they don't include steroids, but they still have that anti-inflammatory effect, so they're going to be very effective on treating for pain. So we have for horses, we have phenylbutazone, which is known as bute. We also use Banamine, um, known as flunixin, and both of those again are for horses only. So that's butazone, Banamine. We can use them in livestock too, but we're not going to use those in small animal medicine. Bute is more for lameness or issues with their joints, orthopedic type issues, versus if it is a gastrointestinal upset or a colic. Colic is just a general term for some type of gastrointestinal problem. Banamine is going to be the medication we're going to want to give for that. So those are kind of two main ones that we use for horses. In dogs, we use carprofen. It's known as Rimadyl. We can also use meloxicam, known as Metacam. In cats, we like to use Onsior. And we went over it previously, but there are a lot of narcotic pain medication, which we'll show you here as well, that can be used, of course, for pain as needed. Now, you'll see on here that aspirin is listed. We can use aspirin in cats. We can also use it in horses. That being said, things like ibuprofen or naproxen, those over-the-counter NSAIDs, can be poisonous to animals. Please do not give ibuprofen or Tylenol to your animal, please, ever. Unless it's under the guise of a veterinarian. They will never tell you to give ibuprofen, though. That is absolutely toxic to dogs and cats. That being said, even with medications that aren't necessarily toxic, like aspirin, we have to make sure we're dosing this correctly. Because if we don't dose this correctly, you absolutely can overdose and kill your animal. That's the problem with ibuprofen. There's not really a safe dose that we can give without running inherent risks. So be aware of that there are medications that we can use that are human medications. But another thing that you have to consider is that with animals, the medications that we make for humans can have a lot more additives than medications we make for animals. So, for example, it can include things like sugar, it can include things like alcohol, it can include dyes and artificial things, artificial sweeteners and things like that. All of those things, especially if it has an artificial sweetener, can be deadly to animals. And so, if you've ever taken a pill and the coating tastes kind of sweet, it's usually a sweetener. I know it's crazy that in America they literally would try to make medication sweet, but they do. Um, so that type of stuff absolutely is toxic to animals. So we have to be aware of that. Even if the medication itself, like aspirin, that's not inherently toxic. But if you give them the human version that has all that coating on it and could have other ingredients that are toxic to animals, you could still kill an animal. So we do have special formulations of, for example, aspirin that's marketed just for horses. Um, and again, it's at an appropriate dose for horses, and it's not going to have any of the additives that you're going to see in human medication that could be toxic to them. So I just want you to keep that in mind. And if you're ever unsure, make sure to ask the veterinarian. A veterinarian you're working under, if you ever have any questions about that, they'll answer any that you have and be able to get it at a formulation that's safe. But rule of thumb is even though it might be a medication you can get at the drugstore, human meds really should not be given to animals because of the risk of additives. Now, I do want to talk a little bit about acetaminophen. This is also known as Tylenol. Now, acetaminophen is not technically an anti-inflammatory drug, but it's grouped in with NSAIDs, but it is analgesic and antipyretic, so it does have some pain relieving effects. However, It's not necessarily anti-inflammatory. So it can take pain away, but it's not going to take swelling or inflammation away. That's why they, for example, like in humans post-surgery, acetaminophen is not usually something you give to a surgical patient. Usually you would go for something like ibuprofen because it actually will help take down inflammation. So acetaminophen is a really great fever reducer and it can help with pain, but it's not going to be really good at, honestly, there's so much better medications than acetaminophen that I think has much better effects. It's technically grouped with NSAID, but it's not an NSAID. Phenacetin is also another one that's metabolized to acetaminophen. So pretty much is acetaminophen. It's just it's the form that it comes in before it's metabolized. Another anti-inflammatory drug that's on here is gold salts. These are used to treat severe immune-related skin disorders. You're not going to see that used very much unless you were to work for like a dermatologist and really work in the network of allergies and skin-related stuff. You're not going to see a lot of those treatments just available at a general practice vet. A little bit more specialty with that. Okay, we're getting into another subject here with medications. We are looking now at disinfectants and antiseptics. So let's talk a little bit about the differences between these. If you were in Module 105, that's the surgical module, you did learn about the difference between a disinfectant, antiseptic, and sterilized. But for those of you that weren't, we're going to review that here really quick. So a disinfectant will destroy pathogenic microorganisms and their toxins. A disinfectant is what we use on an inanimate object. So, for example, I would disinfect the exam table. I would disinfect the cage, right? That's an inanimate object. Versus an antiseptic is still it's going to do the same thing as a disinfectant. It's going to destroy pathogenic microorganisms and their toxins, but we use an antiseptic on living tissue. So you would use it on an animate object. You would use a septic technique for the surgical scrub that you're doing on the pet that's going to have surgery. You would use antiseptic technique when you're scrubbing into surgery, scrubbing that wound. You're cleaning the patient's wound or skin or where it's about to have an incision. So that's aseptic technique. Then we have sanitizers. Sanitizers, so like Purell hand sanitizer, that reduces the number of microorganisms, but it doesn't eliminate all of them. So you'll see that where it's like, oh, 99.9%. And it's because it's true, there are microorganisms that it's not going to be able to be sufficient in eliminating. Now, food for thought. I don't like hand sanitizer in veterinary medicine. And let me tell you why. One is vet medicine is dirty. Y'all, we're dealing with animals and their fur and slobber and hair and dirt and other bodily fluids. And I wash my hands all the time. You will either find me if I'm in a veterinary clinic, I'm either going to be wearing gloves or I'm washing my hands probably 2 or 3 times within an appointment. Hand sanitizer, I know they use it a lot in human medicine, but they're not touching dirty animals. And I don't mean that all the animals coming in will be dirty, but not a lot of people get their dogs or, a fresh bath before they come in. And if you work in emergency, you might be seeing animals that have gone through some kind of traumatic injury, like a hit by car. They might have gravel and dirt and anything else up in their hair. So we want to be aware of that. You are going to be it is dirtier than human medicine. It's just the fact of the game. So I avoid it. I just because I can slap it on my hands, and slather it up and sanitize really quickly. That doesn't take away all the dirt and grime and other stuff that is probably within my fingers. So again, gloves or be washing your hands constantly. I would avoid sanitizer. Another reason why I'm not a big fan of it is because it smells. It's like really high alcohol content, and animals are very sensitive to smells. They have a heightened sense of smell, especially dogs. And even just smelling that alcohol can be very off-putting for animals. And think about it, you're going to be restraining them. Your hands are right up in their face and right by their nose, their olfactory. So I like to not trigger animals in any way if I can avoid it. In vet medicine, we don't even wear perfume. Get used to not wearing perfume and only wearing deodorant because even perfume can absolutely irritate animals. So we tend to not use things that, again, have a lot of scent or smell to them. And even though the smell goes away from the sanitizer somewhat quickly, I just don't think it's that clean. I really don't. I'm not a big fan of it. Um, that being said, do with what you will. As long as you're cleaning yourself and you feel like you're cleaning between patients and all of that, more power to you. But my personal preference would be no. I don't feel like it's that clean. I just don't. Now, when it comes to sterilizers, when we sterilize equipment, for example, we'll be sterilizing all of our surgical packs, all of the equipment, all of the um, gowns, the towels, the surgical instruments, everything goes through what's called an autoclave. And that's a machine that will sterilize the items. Now, I want you to think about sterile this way. Sterilization, if something is sterile, that means it is 100% clean. It is the cleanest of all clean that you could ever get something to be clean because when you put it through a sterilizer, it completely destroys all microorganisms. So nothing. It will, again, the cleanest of clean that you could ever get it. And there's two different types of autoclaves that we use. We use steam autoclaves and then we use gas autoclaves. Again, both of them will completely destroy all of those microorganisms and give you that sterile packs that we need in surgery. And don't worry, we come back to this and I teach you all about the different sterilizers and how we use them in Mod 105. Now, we also use other different types of disinfectants, antiseptics. So there's phenols. These are disinfectants that we use against gram-positive bacteria. We also use alcohol a lot, like isopropyl alcohol. We like to use a 70% dilution of the isopropyl alcohol. It is a skin antiseptic, so we can use it directly right on the skin. We will usually use it in conjunction with the surgical scrub when we are doing aseptic technique to prepare a patient for surgery. So you would use like chlorhexidine or iodine as that surgical scrub and then follow up with that alcohol. We also use it for blood draws to prep for catheter placements. We can also spray it and use it to clean cages and tables. It's a multi-use. We can use isopropyl alcohol for anything. It's actually really, really underrated. There's also quaternary ammonium compounds. These are different disinfectants that we can use that are going to be very broad spectrum. But certain compounds can be ineffective against non-enveloped viruses. Um, the ones that we like to use in class, we like to use, it's called Excel, and it's a really highly concentrated version of hydrogen peroxide, super concentrated. And it pretty much eradicates, gosh darn, nearly everything. We use super powerful disinfectants. That being said, we can use chlorine compounds. This would be things like household bleach, that can be a decent disinfectant against quite a few types of fungi, viruses, bacteria. We don't use bleach that often, just again, because of the smell. We have to be really careful about that around with animals, the smell. Um, but if we needed to bleach something, whatnot, we could use it. But again, we have really strong disinfectants that we use. Again, it's called, I'll put it in the chat, but it's called Excel. I recommend do a little research of it if you have never taken a glance at the bottle or really looked at it much. That is the kind of the top cream of the crop kind of disinfectant cleaner that's on the market right now for vet med. It used to be back when I was in school, it was called Rocal, and it was this dark green. There might be two C's in Rocal. I can't remember. It was like this dark green disinfectant, and it was awesome. It was the best cleaner, but they since then have been switching over to now Excel being kind of the better one that's on the market now. It's not as irritating if you accidentally inhale or get exposed to it. Rocal, if you accidentally, like if you sprayed the area and accidentally breathed in um, some of the droplets, it would irritate your lungs and you'd be coughing for a while. It was an irritant inhalant, so that was kind of a downside of Rocal, but that was the one that I initially started out with when I was a baby in the field for sure. So you'll see where that can change over time, and it's okay if your hospital doesn't use Excel. There's other really great cleaners, disinfectants on the market that are just as good. Those are just ones that we preferably really like and that we use. Okay, next here we have iodophores. These are topical antiseptics. So this is what you would put on the skin. So for example, iodophores contain iodine. So this is going to be like your Providine iodine surgical scrub, which used to be the surgical scrub that we used for everything, humans, animals, everything, and everybody. However, it's most common in people. I've never really seen animals have a reaction to iodine, but I do know that humans can be allergic to iodine. So it's really important to make sure you do a little test on yourself. Take some iodine and expose like just do like a little paintbrush along your wrist or along your arm. Let it sit for, 5-10 minutes. Make sure you don't have any reactions to it. Most common reactions are going to be a skin rash or irritated itchiness. Some people are allergic. That is why they came out with chlorhexidine, which is a surgical scrub that we use now that is hypoallergenic. And so it's really good for anybody who has those type of allergies. That being said, I prefer iodine Providine if I can. I know it's kind of the more old school medication, but I do think that it's really great, and we primarily use it with livestock. It's very effective. The only downside with Providine iodine is it will stain your skin if you do not wear gloves because it's like a really deep iron rich color. So it'll dye your skin yellow for days. So you have to wear gloves whenever you're dealing with it. Chlorhexidine is like a light blue or a light pink, and it won't stain you at all if you're using it. And that's, again, you're more than likely going to have contact with chlorhexidine because that is what's going to be that hypoallergenic option. There's also biguanides. These are also antiseptics, more common surgical scrubs. They do have a long residual activity if left with contact with the site. So we can use this again most commonly as surgical scrubs, and we're usually using it to treat superficial wounds, or we're scrubbing the area before the doctor does an incision for a surgery. And we will get into this more in your surgical module, but when you are doing a aseptic scrub, we do want to make sure that you're making contact with the skin for several seconds. It shouldn't just be like a scrub, throw it away. It's going to be several seconds of scrubbing back and forth and really making sure you have contact with the skin in order to give it the full benefits of having the virucidal, bactericidal, fungicidal for that aseptic technique. All right, students, with that being said, y'all, we are at slide 101. We are completely done with your chapter 8 PowerPoint, pharmacology, and pharmacy. So completely done with chapter 8. With that being said, students, I'm going to end the recording in just a moment right now.